here comes our first speaker. Ladies and gentlemen, Chris Kenobi. Chris Kenobi is currently leading a team of researchers, which includes 4 general ophthalmologists, 3 retina specialists, a PhD vision scientist, and a nutrition researcher in ongoing research regarding man-made processed foods and the increasing prevalence of age-related macular degeneration. This hits home for me because my mother, my dear sweet mother, is going through this now. And I know the challenges of all of that. So Dr. Kenobi has been a frequent presenter for the Ancestral Health Symposium, the Weston A. Price Foundation, and the Macular Degeneration Association. And he's presented to colleague physicians, researchers, ophthalmologists, optometrists, and vision scientists at these conferences, as well as the Christian Ophthalmology Society, All Docs Annual Convention, Low Carb Denver, and the Eye Care Center of Northern Colorado, all for CME, which you can get some of that today as well, right? We're giving out our CE. For sure. Dr. Kenobi has been certified by the American Board of Ophthalmology since 1997. He's been the featured guest on numerous broadcasts and articles, including reviews and podcasts by Dr. Joe Mercola, Dr. Eric Berg in the winter of 2020. That would be a year ago. Dr. Kenobi has appointed the prestigious position of Honorary Board of Directors member for the Ocular Wellness and Nutrition Society, where he delivered the keynote address at their annual convention. Dr. Kenobi is the founder and president of the nonprofit organization Cure AMD Foundation, where he can be reached via the official website, write it down, cureamd.org. Dr. Kenobi accepts no book royalties, compensation for his research, or compensation for his role in directing the Cure AMD Foundation. Wow. I don't think you could be more qualified to speak, and I'm excited to have you here, Dr. Chris Kenobi. Thank you for being here, and take it away, my friend.
Thank you, Chris and Michelle. It's a pleasure to be on the show. Colleagues, could heart disease, hypertension, stroke, cancers, type 2 diabetes, metabolic syndrome, overweight, obesity, Alzheimer's disease, age-related macular degeneration, autoimmune diseases, even dental caries and dental malformations, could all of these diseases and disorders be driven by none other than processed foods, man-made, westernized foods? This is the hypothesis that I'll present and defend to you today, because this is where the science has led me over the last 10 years of research and investigation. So I'm going to begin here, and I'm going to submit to you that I believe there are 2 fundamental primary drivers of overweight, obesity, and chronic disease, and they are nutrient deficiency and toxicity. But there's a sole driver for this, and it's man-made, processed, nutrient deficient, and toxic foods. And if you flip this on its head, now we get at the 50,000-foot view, and we can really start thinking of this as just one thing. Processed foods are driving all of this disease through nutrient deficiency and toxicity. So everyone here knows that the world is getting heavier. The United States has led the way in this battle for decades. But I want to submit to you, overweight and obesity are not the problem. They are a symptom of the problem, because all of these conditions are driven by the same thing. Now, I'm going to walk you through 200 years of medical history in the next 4 or 5 minutes, and you're going to see that chronic diseases have risen from rarity to ubiquity throughout the world. All right, so let's go to heart disease. So in Boston, 1811, there was no heart disease deaths listed for the city of 30,000 people and about 940 deaths. 25 sudden deaths, which is 2.6%, probably all of them coronary valvular disease. We'll come back to this. The entire 19th century, 1800 to 1900, there are 8 papers on heart disease, 2 of those thrombotic. In other words, 2 of those probable heart attacks, right? It's incredibly rare. In fact, Sir William Osler, famed physician of Johns Hopkins Hospital in Baltimore, published a paper in 1897. He reviewed his previous 21 years of hospital experience. He had witnessed about 6 cases of angina, chest pain that might be related to heart attack, and he had never witnessed a heart attack. 13 years later, he spoke in London, England, and he noted an additional 208 cases of angina in that 13-year period. He had still never witnessed a heart attack. Well, most of the world hadn't either. He wasn't alone. In fact, we know this from other research. In 1900, 12.5% of deaths in the United States were due to heart disease, but these were all valvular disease cases driven by syphilis, endocarditis, and rheumatic fever, not coronary artery heart disease like we think about today. In fact, in 1912, John Herrick published the first known case of heart attack in the United States. First case, documented with autopsy evidence. 1930s, coronary heart disease becomes the leading cause of death. It was virtually unknown 25 years earlier. Why? What happened? All right, today, 32% of deaths, almost 1 in 3 due to coronary heart disease. The increase looks something like that red line right there. All right, let's go on to cancer. So back to Boston, 1811, 1 in 188 people died of cancer. 1900, 1 in 17 people in the US died of cancer. 2010, almost 1 in 3 dying of cancer. And this is not about aging of the population. I don't have time to go through that today. That's another talk, but it is not about that. This is a 62-fold increase in cancer deaths in 200 years. How about type 2 diabetes? We know diabetes of any type was rare in the 19th century and presumably for all of history prior. By 1935, it's already rising, 0.37%. 1960 compared to the 1935, up 2.5-fold. 1991, up 8-fold. 2010, up 19-fold. 2015, up 30-fold to 11% and still rising. This is a 30-fold increase in type 2 diabetes in 80 years. Try to explain that. All right, how about obesity? We know from prisoners in Texas and Nebraska, men age 18 to 80, that obesity was 1.2% in the 19th century. Now, we think we were lean in 1960, but obesity had risen 11-fold to 13%. By 1988, it's 23%. By 2005, 34.3%. By 2015, 39.8%. 4 out of 10 adult Americans obese, and we're on target to be 50% adult Americans obese by 2030. Everything I'm going to tell you today is published evidence except for one piece of data, and I'll point that out. So obesity up 33-fold in 115 years. Again, you have to ask why, right? Metabolic syndrome, it's a new disease. In 1990-ish, 24% of adults had metabolic syndrome. Around the turn of the century, 34.1%. 2006, 40%. Recent, 88% of Americans cannot meet 5 criteria of metabolic health: blood glucose, triglycerides, HDL, blood pressure, and waist circumference. That means 1 in 8 Americans recently is metabolically healthy. How about macular degeneration, the leading cause of irreversible vision loss and blindness in people over the age of 65 worldwide? We know that when macular degeneration was first discoverable, 1851, in the next 80 years, there was less than 50 cases in all the world's literature. Yet by 2020, 196 million people in the world. So back in 100 years ago, 1 in many, many thousands of people were affected, whereas today, again, it's almost 1 in 3 again. The increase, again, looks something like this red line. All right, so let's walk through dietary history, and I want to show you that westernized foods correlate to all this chronic disease, and you can rapidly start beginning to jump to causation out of this. But this is a global human experiment is what this really is, and no one gave consent. So 4 main foods are processed foods. Sugar. Now, we're going to begin with sugar. Sugar has been in the food supply for centuries, but between 1822 and 1999 increased 17-fold. The first polyunsaturated vegetable oil introduced right after the American Civil War, 1866. The world had never had polyunsaturated vegetable oils. 1880, we got refined wheat flour, a nutrient-deficient food. 1911, Procter & Gamble introduced Crisco, trans fats. That, colleagues, is processed food. That's it right there. You put those 4 foods together and you can make hundreds of thousands of foods. Now, in 1939, Weston Price noticed, which I'll review later, that these foods are connected to westernized disease. Nobody listened. 2009, our own USDA shows us that 63% of the American diet is made up of those four foods, and diseases of civilization look like that red line right there. This is their data from our own USDA 2009, processed foods, added vegetable oils, trans fats, sugars, and refined grains. That's ultra processed food, actually. And the total processed food is now 75% in the US and in the world. And this is the breakdown, all that in the red of those different categories of processed food today. Now, I want to go back to the early 20th century. This man, Elmer V. McCollum, nutrition researcher, he and colleagues did extraordinary research on animals, trying to figure out all this about nutrition. And this is one of hundreds of examples. So these are two sets of rats on identical diets and identical rats given the same diet except for the fat source. And the rats on the left got 5% cottonseed oil as their only fat. The rats on the right got 1.5% butterfat as their only fat. Here's what happened to them. The rats on the cottonseed oil grew to 60% of normal size, survived 555 days, and they're weak, fragile, sickly rats. The rats on the butterfat are healthy, grow to normal size, and live 1,020 days on average. So the rats on the butterfat are twice as big, infinitely more healthy, and live about twice as long. Why? Because of fat-soluble vitamins in the butterfat and lack of toxicity. Back to those two concepts. All right, so McCollum in 1918 in his book, if you look at what I've underlined, he states the diet must contain two as yet unidentified substances or groups of substances. And he's talking about water-soluble vitamins and fat-soluble vitamins. But he doesn't know that here. He says one of these is associated with certain fats and is especially abundant in butterfat, egg yolk fats, and the fats of the glandular organs such as the liver and kidney, but is not found in any fats or oils of vegetable origin. None of these oils carry the fat-soluble vitamins so critical to our nutrition. He goes on to say this, both the growth-promoting fat, which is like the butter and eggs as examples, and organ meats, and the trace of an unidentified substance in the alcoholic extract of wheat germ, which was the water-soluble vitamins, he says are necessary for the promotion of growth or the preservation of health. The animals didn't need these just to grow, and neither do humans. We need them to sustain us in adulthood, in good health. So Weston Price then understands all of these principles in the 1920s, and he sets about to discover more about this in the world. So he embarks on a journey on 5 continents and 14 nations around the world, evaluating people while they're still on native traditional diets. And all over the world on 5 continents, he finds people that look like this. People that are fantastically healthy, happy, beautiful, robust, and have perfectly natural, straight teeth, more than 99% cavity free. And these people don't have toothbrushes, toothpaste, or floss. Most of them had never heard of such. So these are more faces on native, traditional, non-Westernized diets that look like this and this on their native, traditional diets. And physiques that look like this, robust, healthy individuals that are immune to chronic disease and immune to infections on their native traditional diets. Here's some more faces from all around the world on 5 continents. All right, but Price discovers that as people begin to consume what he calls the displacing foods of modern commerce, which he defined as refined white flour, sugars, canned goods, sweets, confectionery, and vegetable oils, which are Westernized foods, that then they began to develop dental decay first, like these 2 ladies on the left. All 3 of these ladies are Australian Aboriginals. The 2 on the left were consuming a Westernized diet. And this is what happened to their teeth. The one on the far right, she continued her native traditional diet. And if you amplify this scenario thousands and thousands of times on 5 continents, that is Price's work essentially right there. Remember, these people mostly didn't have dentists. They didn't have the luxury of coming to doctors of dentistry like yourselves. More faces on Westernized diets. Look at the severe dental decay that you see, particularly in the lower 2 columns. or rows. And then dental malformation, because the lack of vitamins and minerals in the diet led to narrowing of the maxilla, narrowing of the dental arch, and therefore crooked, malformed teeth on westernized diets. And this rapidly produced dental decay and dental malformations like you see in all of these images here on what Price called the modernized foods. Again, the refined flours, sugars, and vegetable fats mostly, all right? This led to physical deformity, deformities of the face like this, crippling physical deformities like club feet, and more physical deformity and even tuberculosis. But Price called this intercepted heredity. In other words, the DNA blueprint cannot be fulfilled unless it has the activators, which is the vitamins and the minerals and the proteins and the fats to properly fulfill the goal that the DNA provides. So this was followed, the dental decay was followed by arthritis, cancers, loss of immunity to tuberculosis, which the people had, and other infections. They had great immunity to infectious disease until they began to consume the westernized foods. But this is what we see in our children's mouths and teeth today, right? Dental decay, arch deformities, malformations, widespread. Why? Because of westernized, nutrient-deficient diets. The primitive diets Price found, and there was dozens or hundreds, they were nutrient dense, very dense in vitamins and minerals. They were all diets of plant and animal origin. They all contained sacred foods rich in fat-soluble vitamins, and none contained any of those processed foods. Price sent back samples of these foods from all over and found they contained 10 times as many fat-soluble vitamins, A, D, and K2 primarily, 4 times as many water-soluble vitamins, which is all the B vitamins and C, and 1.5 to 60 times more minerals than did the American diets of his day, which is the 1930s. We have far more processed food today, far more. So why were these people so healthy? These native diets produced physical excellence, prevented chronic disease, produced splendid facial and dental arches, and prevented dental cavities. Let's look at westernized foods in US history. Here's what happened, and this is our data. We consumed 6 pounds of sugar per person per year in 1822, rising to 108 pounds per person per year by 1999, a 17-fold increase. Sugar is a nutrient-deficient food. Second, how about wheat flour? Was it the problem? Well, we consumed twice as much wheat in 1880 as we did in 1980. But here's what happened to it. Roller mill technology introduced in 1880. And roller mill technology gave us nutrient-deficient refined wheat. So that's 85% of our food, and that's 17% of the diet. And this is vegetable oils, introduced all over the world for the first time in the US in 1866. And we went to 80 grams a day in 145 years. That's 32% of US caloric intake. And if you look back, you will see that in 1900, 99% of our added fats came from animal fat. Back when we were healthy, we didn't have heart disease and cancers and macular degeneration and obesity, right? And today, in 2005, 86% of added fats came from vegetable oil and still on the rise. Didn't just happen in the US. In developed countries in this 40-year period between 1963 and 2003, vegetable oils doubled. They tripled in developing countries in this period, went up 4.5-fold in Japan, for example, 8-fold in China, and the world's becoming sick, right? So if you look at these oils, beginning from the 5th one down, cottonseed oil, all that blue is the omega-6, which drives so much of this disease, all right? This is the omega-6 linoleic acid we would have gotten in 1865, and for most of the world, coming from butter, lard, and beef tallow at 3, 2, and 2% from native, traditional, ancestrally raised animals. But so what did this do to our omega-6 linoleic acid consumption? It was 2.2 grams a day in 1865, rising to 29 grams a day, or 11.8% of our calories in 145 years, roughly. That's a disaster. Look at heart disease here versus vegetable oils. So heart disease in the red and vegetable oils in the black versus saturated fat. There's no relationship to saturated fat, but look at the incredible correlation to vegetable oil. And you can see linoleic acid, omega-6, accumulates in our fat, 9.1% in 1959, 21.5% by 2008. It correlates in our body fat to obesity and to vegetable oils, because this is where they're coming from. And look at the correlation here between seed oils and diabetes and prediabetes. Remarkable correlation. All right, so processed foods are driving all of this chronic disease, including dental malformations and dental caries. The devil's triad is sugars, refined flours, and vegetable oils and trans fats. And this is the reason why vegetable oils are so bad. They're pro-oxidative, pro-inflammatory, toxic through advanced lipid oxidation end products, and nutrient deficient. Put that together, that is a recipe for disaster, and why everywhere these oils go, disaster follows. These fats are not the same, all right, from the vegetable oils and pasture-raised animals. The vegetable oils are toxic. Animal fats, raised traditionally, supremely healthy. So I will submit to you, 80% of our chronic disease is coming from vegetable oils and trans fats. And how do we get this? How do we change this? Eliminate processed foods, understand this scenario, and consume less than 2% of our diet from omega-6 by eliminating seed oils. Mark Twain said, it's easier to fool people than to convince people they've been fooled. We've been fooled, ladies and gentlemen, and we've been fooled to believe that it's more about the food how much food we eat rather than what we eat. Ancestral diets drive ancestral health. That's the take-home picture. Thank you very much. It's been an honor and a pleasure to present to you today. Thank you.
A great presentation. If people want to learn more about the diets I mean, it's pretty simple. You stated it pretty clear. It's like, stay away from the processed foods. The information about sugar and where we've gone in this world. There's a big movement right now to eliminate sugar completely from the diets, and that might be another hot topic for us in the not too distant future. But the cancer deaths, the diabetes, the obesity, the metabolic increases, the fact that only 1 in 8 Americans are really healthy in terms of metabolically healthy. That's a crisis. And thanks for bringing that to us.
Michelle, what an incredible kickoff for Hot Topics. If you could watch me, and that I was like doing this the entire time. And Dr. Susan Maples, who is a board member, her message was exactly what I think most of us are feeling. And she said that right there. Powerful message, depressing, but just imagine. We really do have amazing opportunities to help by collaborating and not being afraid to educate our patients. And I hear all the time, well, when I work with hygienists, well, I'm just a hygienist, and even dentist, I'm just a dentist. That's not our role. It absolutely is our role. And we have to collaborate with physicians like Dr. Noby and nutritionists, etc. So thank you so much for opening up today. That was incredible.
Go back to the past, everybody. Those native traditional diets. That's sounds simple.
Yeah.
But what is out there in the world is what's driven by money, I guess, and profit, and convenience. Mm-hmm. But take the time and do it right. Chris, once again, Dr. Kenobi,
wow.
You have brought us a great message and a great kickoff presentation. So thanks again.
Thank you, Chris and Michelle. It's been an honor.
All right.